Good evening.
Good evening. Hello.
So before Ashley gets started, I'll just do a brief introduction. First, I want to take the opportunity and introduce most of our management team from Public Health tonight. Myself as director, Ashley Waite is our supervising public health nurse. Recently moved to that position from our health planner position. And then when Ashley moved to that, Joe Austin was promoted then internally to our health planner position. And Lori Simmons is our Children with Special Needs Program Coordinator. Paula Kaufman is our fiscal manager, and she wasn't able to be here this evening, so just wanted to take that opportunity. If you may remember, back at the end of 2012, the Certified Home Health Agency and Hospice were moved from Public Health over under the hospital's auspice. At that time, I started then in 2013. And we have been working on who are we as public health without CHA and hospice. Many people think about public health and they think about the nurse that comes to their home and provides services. And that is what public health has been historically. And we are moving forward into a whole new arena for public health, not just in our county, but across the country. So Ashley, as part of her role as health planner and also as part of her work on her master's in public health, she needed to do an internship this past summer. So she graciously took on helping us create a strategic plan. And as part of that, her responsibilities was to present that to a number of different groups, including the Board of Legislators. So Ashley's going to be presenting our draft strategic plan. We hope you like it, and we certainly want to entertain any discussions and questions tonight with the hope that we can approve it at the board meeting this evening. So, all right, without further ado.
All right, thank you. So we'll go ahead and get started. These are the areas I'm going to cover. First, we'll go through the strategic planning process. Then we'll identify our mission, vision, and values that we came up with during this process. The 5 priority areas we identified that we will be working on over the next 5 years, and also some of the specific work we hope to complete within the next 5 years. So a little bit about the strategic planning process. It started out with a survey that was sent out to all staff, our Health Services Advisory Committee, as well as the Board of Legislators and the county manager, who at the time was Liz. So the survey asked questions like if they liked our current mission and vision statements, what they thought about the current state of public health as well as the future state of public health, some of our strengths, weaknesses, opportunities, and threats. The next step, we established a team to work on this, and this was an open invitation. Anybody could be part of the strategic planning committee. It consisted of staff, Health Services Advisory Committee members, as well as the county manager, who at the time was Ryan, who participated. So the next step was taking all of the data that was collected in this survey process and compiling it. We found some common themes, so we put those together in a format that was easy for the committee members to review and analyze and see what kind of information we pulled out of that to put forward into our strategic plan. Another thing we did at one of the first meetings was discuss Public Health 3.0, and I'll go into that further on the next slide. We established our mission, vision, and values, set our priority areas, and then also established goals and objectives for each priority area. And we'll go into all of those. So, what is Public Health 3.0? In the past, we started out late 19th century, early 20th century with Public Health 1.0. And that was when we first started with immunizations. We expanded epidemiology, which is the study of disease. We increased food and water safety as well as sanitation. In the second half of the 20th century, we transitioned to Public Health 2.0, and that was really just formalizing what a government public health agency is and what they do. And again, as Penny said, a lot of it was the nurse going door to door and things like that, very clinical focused. Public Health 3.0 is shifting away from that clinical focus to a more population health focus. They're pushing for cross-sector partnerships, so we'll work with other community partners, and they're wanting public health to be the chief health strategist. So we're driving the work of other people to improve the health of our community. You'll see on the bottom of that pyramid is the social determinants of health, and that's really where they want us to focus. So you get the biggest bang for your buck down there. You're going to have the greatest impact with the least amount of effort. So those are things like a lot of policy work, things that are going to change the way people live to improve their health or improve their access to health care. Any questions on Public Health 3.0? Okay. So we started with our mission and vision and values. So the mission that we came up with is to promote and protect the health of our community, with our vision being healthy people living in a healthy community. Values, we value integrity, we act with honesty and adhere to the highest standards of moral and ethical values and principles. Teamwork, we have a commitment to reach common goals, leveraging the ability of all team members. Community focus, we demonstrate a passion for community health and well-being. Innovation, we creatively apply the most advanced technology, information, and research to be revolutionary leaders in public health. And the last three are excellence. We strive to provide the highest quality service through continuous quality improvement and learning. Collaboration, we work collaboratively with partners in the community to improve health and support a strong public health system. And accountability, we honor our commitments, put forth our best effort to meet goals, and hold ourselves accountable for results. So all of these, the mission, vision, and values were all sent out to staff prior to final approval at the planning committee meeting, and everybody was in agreement that these are important to us and they like the mission as well as the vision. So we set 5 strategic priority areas. This came out of that data we collected from all of the survey participants, as well as going forward what Public Health 3.0 is going to look like. So the 5 areas are infrastructure, workforce development and leadership, strategic partnerships, research and data-driven performance, lifelong health, and well-being. And I'll go into each one of those more specifically here. So the first is infrastructure. We hope to become an accredited health department by the end of this strategic plan, and that is accreditation from the Public Health Accreditation Board. It's quite an in-depth process, but it's proving that we are a high-functioning public health department who's meeting the needs of our community. The second thing under infrastructure is establishing a market position, brand, and health communication strategy. So we currently have our health communication and social marketing committee working on a plan to ensure that all of our messaging is consistent, the look that we put out is consistent, so whenever somebody sees something from public health, they know that it's us, and they know that it's reliable information that they're getting. The third thing is assessing our physical space. Where we're located in the basement, split on 2 different floors, was mentioned a lot in our survey responses. So one of the things we're going to do is participate in the county space study, and then just look for opportunities to be more visible in the community as one agency, so not being split. Cultural competency, we have a cultural competency committee, and they're also currently working on a plan to ensure that we're meeting the needs of all cultures that present to us here in Lewis County. The last thing under infrastructure is developing a service matrix. So we'll be looking to work with relevant stakeholders to develop a service matrix based on what our community needs. So the healthcare system is changing, and us as public health is changing. So we need to identify what are the services that we need to provide to our community that other stakeholders aren't currently providing. The next priority area is workforce development and leadership. We're currently working on a workforce development plan. This plan will cover training, recruitment, retention, as well as succession planning. Collective impact training. The collective impact model is a framework to tackle very complex social problems. So it's a structured approach to make collaboration work across government, business, nonprofit organizations, as well as our residents to achieve a lasting social change. This is really going to be important going forward. A lot of different community agencies are working on a lot of the same initiatives. So if we can pull together and work together, we'll decrease the amount of resources needed. We won't be wasting time all doing the same thing and not really going anywhere. If we streamline things, we're apt to have better success. Employee satisfaction, we're looking to improve that with this. Cross-training, we're looking to cross-train staff to maximize the use of our current resources. It will help with absence of an employee having coverage and the capability to continue working, as well as improve workflow. And position assessment. So as positions open up, either with retirement or resignations, we will be assessing those positions to ensure that that specific civil service position is what we need for our agency, or if we need to change that. The next priority area is strategic partnerships. So this was very important in Public Health 3.0, like I talked about with the collective impact. We need to find community partners with shared vision and goals and work with them collectively to achieve these goals. Sharing resources again, and ensuring public health has a seat at community planning tables. So an example of that would be if a new road were going in and it was close to town, does it have a sidewalk where people could walk? So thinking about health when we're doing any kind of community planning. The next priority area is research and data-driven performance. 2 years ago, we assessed all of our programs at Public Health to see what was evidence-based that we were providing and what wasn't. We discovered that 79% of what we do is evidence-based. The rest is a lot of state-mandated programs, not really studied, so there's not the evidence out there. But going forward, we'll ensure that whatever we're doing, if we're implementing something new or changing something, that we can make it as evidence-based as possible so that we're providing programs and services that are proven to work. The second part of this is to monitor our progress and use this data to drive our quality and process improvement. The last strategic priority area is lifelong health and well-being. So we will be continuously monitoring and evaluating the progress of the Community Health Improvement Plan that was put in place in 2017. And as well as ensuring public health and our partners are complying with health literacy standards. So this means we want to ensure that all of the residents of Lewis County are able to understand all of the health information that's given to them. And there are very specific standards that all provider practices, any community organizations providing health information as well as public health should comply with. The last area is increasing community access. So we would like to seek opportunities to integrate our services into community settings such as schools and work sites, as well as identify opportunities to use technology to deliver our services. So an example of that might be providing one of our evidence-based classes via web conferencing rather than having them come to our office for that. So that is it. Are there any questions on any of that?
I have one. What does the accreditation do for our public health department?
Well, it proves that we're doing things how we should be doing them and to a high standard. It's not currently mandated, however, it's moving that way. So we're at least thinking about it, we're preparing for it. It's a very long process to prepare for. So in case it does come that way, we will be ready.
And when it does become mandated, there's a good chance that any funding that we may receive may be tied to whether or not we're
That's what I
accredited.
was wondering.
Any other questions? Okay, I have one other quick little presentation.
Right now, the staff, Ashley mentioned, we have a cultural competency committee. We have a marketing, education, communication committee. They're working on specific work plans to actually implement this strategic plan. So there is a lot of those. This is a really high view of our strategic plan, and then within it, there are work plans being developed so that we actually achieve these priority areas.
It's only 3 slides. It's very quick, informative.
So we're doing another exercise in 2018?
Yes, we are.
You
So
can
it's not an isolation.
I do the orders.
quarantine.
I do the orders for the court.
Order in the court.
Okay, so we do have another exercise in 2018. This is a medical point of dispensing. So the last pod, that's short for point of dispensing, we had was in 2015. So they're having us drill this again. Different scenario. Last time we had an anthrax scenario. We gave out antibiotics, mock antibiotics. This time it's going to be a vaccine scenario, which will require us to use licensed professionals, whereas last time we were not required to have licensed professionals. So staffing may be a bit of a challenge with this. So it's going to be Thursday, April 26th, 2018 at Laval Academy in their main gymnasium. That is our primary pod site. So we've already completely assessed that area to ensure that it meets all of the standards of a pod site. The scenario, again, is going to be a max vaccination of our entire population because of a disease outbreak. And we're doing this to test our mass medical countermeasures dispensing plan. So, we would love county leadership involvement in this. It's important for you guys to be in the know in this kind of situation, especially if it was a real event. So having this practice would prep you for that. In a real event, the public would absolutely be in panic mode. And they would be looking to county leadership for some guidance. The media is invited to this event, as they would likely be there in a real event. So it would be great to have county leadership there as well. And that's all I have on that. Any questions?
I'm planning on going. I already told Joe I'd be a victim. I just go through the line. How many people do we have to go through per hour? Like 48 or something?
That's an absolute minimum. Our
Yeah.
target is actually like 20% of our population that we need to meet is 104 people per hour.
What's the minimum?
40.
40.
Absolute minimum the state set, yes.
You're gonna have to handle the line.
Well, that's what they're saying.
So what would you like
go
us
through
to
it as
participate
one
in?
victim, then go
Yeah.
around, then they'll give you another name. Another
Multiple.
How would you participate as victim?
You could do that, or you could just come and observe. There's a little area we have that's sectioned
What
off
time
for.
would you start that?
It's going to start at 10:30, and it's going to go until 12:30. Yep.
So are we gonna get more information on this as time goes on, so we remember it?
Yes. Yep. We can do that.
Cause I
Absolutely.
won't remember it from this far back.
Okay.
Remember what she just said.
All right. Any other questions? Okay.
Thank you.
Thank
Thank you.